Welcome to The Explainer. Today, we're talking about a massive gamble in Connecticut. The state is about to get nearly $750 million in federal cash to fix its struggling rural healthcare system. It's so much money, people are calling it a space shot. But is this a launch pad to a better future, or more like a rocket with a 5-year fuel tank? Let's get into it.
So let's start with the question that, for a lot of people in rural communities, isn't hypothetical at all. When a hospital starts to shrink, it's not just some building that goes away. It's the services, the specialists, that feeling of security. And in Connecticut, this is hitting one area of care really, really hard.
You see, the crisis in Connecticut has a very specific and personal face. It's about the disappearing places to have a baby. The state's own application for all this federal money puts a huge spotlight on this growing problem of maternity deserts. Places where access to labor and delivery services is just vanishing. Okay, case in point. Wyndham Hospital in the state's quiet corner. Its labor and delivery unit. It's been closed since 2020. That means for years now, families in that area have had to travel farther and farther away for one of the most important days of their lives.
And then you've got Sharon Hospital. Its maternity ward was also on the chopping block, but a really fierce community campaign actually managed to save it. Now, this was a huge victory, for sure, but it also shows you just how fragile these services are. They're often just one budget cut away from disappearing.
And this isn't ancient history. It's happening right now. Johnson Memorial Hospital's maternity ward is closed and stuck in this regulatory limbo, and it could be shut down for good. This whole pattern created the sense of, okay, we have to do something big and we have to do it now.
And that big something turned out to be this historic flood of federal money. But we're not just talking about patching a few holes here. The goal is to completely reshape the entire system. It's an ambition so big they're calling it a space shot.
This quote from a health policy analyst just nails it. The point isn't just to keep the lights on. It's to fundamentally rethink what a rural hospital even is. So the key takeaway here is this is about transformation, not a temporary bailout. Let's just talk about the numbers for a second. The total grant is almost $770 million. But if you break that down, it's over $154 million a year, every year for 5 years, flowing right into Connecticut's rural health system. For a state that size, that is a truly staggering amount of money. So how did Connecticut get so much? Well, the federal money was split into two big pots. Half of it was a base amount that got spread out among the states. But the other half, that was a competitive fund. It was awarded based on how bold and creative a state's plan was. The fact that Connecticut got such a massive award tells you that officials in Washington thought their plan was one of the most innovative in the entire country.
Okay, so let's dive into that plan. The state's strategy isn't just a shopping list. It's actually built on 4 big ideas, these 4 pillars that are designed to fix the root causes of the crisis.
So first up is population health. That just means tackling big problems like maternity care and mental health head-on. Second is workforce development, basically finding new ways to get doctors and nurses into rural towns, and this is crucial, to get them to stay. The third pillar is all about data and tech, a huge overhaul using AI and unified records to make healthcare smarter. And finally, the fourth one is care transformation. This is about changing how we pay for healthcare, moving away from paying for every little procedure to new models that actually pay for keeping people healthy.
Now, you can probably guess this huge pile of money doesn't come with no strings attached. This is not a blank check. The federal program has some really specific and, you could say, pretty controversial policy requirements baked right in. Yeah, these requirements are part of a framework called Make Rural America Healthy Again, or MAHA. It started as a policy idea under the Trump administration, and it ties a good chunk of the national funding, about $12 billion, to specific initiatives all about prevention, nutrition, and fitness. So what does this actually look like on the ground? Well, hospitals that want this money have to show how they're going to build these ideas into their plans. We're talking about things like food as medicine prescription programs, or partnering with schools to bring back physical fitness tests. It's a real focus on spending money on new prevention tech instead of just buying more equipment to manage diseases people already have. And here's another big requirement, and this one targets that revolving door of rural doctors. Any doctor or nurse who gets loan repayments or bonuses from this money has to promise to work in that community for 5 years. 5 years! That's almost double the usual 2- or 3-year commitment you see in other federal programs. It's a really clear push for long-term stability.
Okay, so with all that cash and all those rules, what's actually going to get built? Well, the state plan zooms in on a few really high-priority projects that are meant to be transformative, to go way beyond what a traditional hospital does.
The state is putting millions towards some very specific goals. For example, they're planning to fund 4 new Crisis Stabilization Centers. The idea is to get people having a mental health crisis out of crowded ERs. There's $14 million for something called a PACE Hub. That's a really innovative program to help frail, elderly people stay in their own homes. And you can see millions more for mental health in schools and new services for autism spectrum disorder. And that right there is the key. The goal isn't just to add more beds to the same old system. It's to build entirely new kinds of facilities. A 23-hour crisis center, for instance, is a place where someone can get immediate, expert care for just under a day. It can stabilize them without needing a really expensive and often traumatic hospital stay. It's a total shift in how care is delivered.
So this all brings us to the biggest question of all. Is this massive bet actually going to pay off? I mean, it's an ambitious plan, it's detailed, but the money is temporary. And yeah, the clock is already ticking.
This timeline really lays it out. The money starts to flow in 2026. These new projects launch in 2027, but look at that last date, 2030. That's when the federal funding cycle ends. So the real challenge for Connecticut is how to make all these new programs and transformed hospitals self-sufficient so they don't just collapse in 2031.
Well, the state thinks it might have a long-term answer. It's something called a global budget. So instead of paying hospitals for every single service they provide, which is how it usually works, a global budget gives a hospital a fixed, predictable chunk of money each year to take care of its entire community. It totally flips the incentive from doing more procedures to focusing on prevention and keeping people healthy and out of the hospital in the first place.
Which brings us right back to where we started. Is Connecticut building a truly new, sustainable model that could save rural healthcare not just there, but maybe across the whole country? Or is this $770 million space shot just a beautiful, 5-year patch on a system that's fundamentally broken? The answer? Well, we're all going to find that out over the next 5 years.